Arthritis is a leading cause of workplace disability. So on the question that was just asked, there's an entry point as well with a politician is if you have workplace disability coming from arthritis and you know that there's a pain management solution out there, cannabis could be that solution, medical cannabis. It causes pain, restricts mobility, diminishes quality of life, and really for the 40% of Canadians with arthritis, the pain is what limits their activities. In a Health Canada report, they report that they call it severe arthritis. Is the diagnosis for more than half of Canadians who are authorized to possess medical cannabis, and they use it to manage their arthritis specifically. And we're interested in lots of research that shows us this because we're always asked that question. What's the research? We need more research, and how does it impact people with arthritis? So anything we can jump on that tells us that people with arthritis are using it. There's growing evidence for the use of cannabis to treat symptoms for a variety of conditions. And cannabinoids have been found to reduce osteoarthritis pain, inflammation, and nerve damage in animal models through some of the research. So I'm just going to go through a little of the research from the Arthritis Society to this ahead of when I joined the Arthritis Society of Canada. At that point, we were not Arthritis Society of Canada yet. She was a fierce advocate in this space, working with many stakeholders, patient groups, government, and a great voice for people who needed this option for pain management. We hosted a medical cannabis research roundtable in 2015. We published a report called Clearing the Air. It called for this $25 million incremental medical cannabis research from the federal government. Arthritis Society of Canada, we're actually the first health charity to fund medical cannabis research, so we feel very proud of that. And we had research published in 2017 promising the benefits, showing the benefits of CBD as safe and effective pain treatment that might address challenges of osteoarthritis. And I know we just heard that sometimes patients require a combination, and we know that, and I'll be going through a little video too that sort of shows you what our resources are. So if you have people in your families, in your networks that want to understand what the Arthritis Society is saying, I'll take you through that a little bit. In 2019, we co-funded a 5-year cannabis research study in partnership with CIHR. And this is one of the researchers we're funding now. He has a $1.5 million grant, Dr. Hans Clark. And he's looking very closely at osteoarthritis and how, so he's, 5-year research project looking at patients using medical cannabis who are scheduled to have knee surgery. And he studied whether cannabinoids and the chemicals found in cannabis are actually reaching joint cartilage, bone tissue, spinal fluid, and all the things associated with osteoarthritis. So this is very exciting, and we hope to keep doing this and do much more of it. And at some point, we won't be asked, we need more research. So our position statement from an advocacy position statement is such, very aligned with many patient groups. It should be prescribed by physicians or health professional or directed towards that medical document for someone to use it. Should be distributed through licensed pharmacies. We strongly believe in that guided use of medical cannabis, that supported use. Somebody might be on another medication, there might be contraindications. It really helps, even if it's an online pharmacist or health professional in the field that's guiding that conversation, that use. It should be free from taxation, so I know this is a bone. Sales and excise in all forms and potencies. It should be eligible for coverage under public and private, both personal employee drug benefit plans. And actually at the Arthritis Society, we are one of the I think we are the first charity to fund or to have medical cannabis coverage in our benefit plan. And here's another just sort of did a timeline, a summary of some of the advocacy that we do and we have done. So to preserve medical cannabis as a separate entity from plans to legalize recreational cannabis, we really want to make sure that the medical cannabis stream remained. And we still want to ensure there is a pathway for medical cannabis, for people who utilize medical cannabis. So this is interesting with the statutory review in that there is a line about cannabis for medical purposes. Why is it in there? Should we be concerned that it's in there? What happens to the separate medical stream? These are all important questions, and hopefully some of the meetings and our work together in providing our our submissions to government on this will help to provide some clarity. In 2017, we had held a multi-stakeholder pain symposium, which had a strong medical cannabis focus. Discussion recommendations were captured in a report, but the nice thing about that report is one of our stakeholders was the Canadian Pain Society. So it was another sort of entry point into looking at the benefits of pain management from medical cannabis usage, and having the Canadian Pain Society behind that was quite key. So our benefit plan added medical cannabis in 2018 to help the help employees who use medical cannabis. And then we developed our position statement in 2018. So that's around the time that Kelly and I joined the organization. They were really looking to sort of align their position and just help to put together a position statement with this, which is on our website at arthritis.ca. And then in 2020, in partnership with other patient groups, which is key, the patient group collaboration has really helped us move forward our agenda of understanding medical cannabis for pain management for arthritis, and having other people at the table, like Daphne will be next from Vogue, or having the MS Society, or having epilepsy, or having other patients groups and other people who represent people who use it, autoimmune conditions, together, where we're all saying similar things is very important to us. So we advocated to have that designated medical cannabis as an essential service to ensure patients received uninterrupted access during the pandemic, because when the pandemic came to be, all things stopped, including mail delivery. So we joined with Medical Cannabis Canada and other partners to sign a letter and say, we can't do that, because this is medicine for some people. Can we make sure that still continues? And we were assured that that would still continue. And then ongoing, we continue to call on the provincial and federal governments for removal of taxes and expanded access to medical cannabis through pharmacy distribution. We like to partner on surveys as well, like I said earlier. So this is one of the ones we did when CFAM was CFAM and not Medical Cannabis Canada. And it gave us some really good data that showed Canadians believing cannabis is legitimate medicine to treat physical pain and mental conditions. That was a really good stat for us to use. Many believe that pharmacies were the most appropriate point of access for medical cannabis. And people are still kind of unsure where to get the best information on medical cannabis. So that tells us we need to do a lot more work. And that includes partnering with government on public education, public awareness. That needs to happen at the same time as we're doing all these sort of regulatory pieces as well. And arthritis is one of the top conditions for using medical cannabis. And then this is a recent study. It is hot off the presses. They just presented, so they couldn't give us any data yet, but we helped to really push this one out. And it was a unique partnership with the Arthritis Foundation in the US. So it was Arthritis Society Canada, Arthritis Foundation, McGill University was involved, their logo's not there, but University of Michigan as well. And just understanding, do you use CBD or cannabis for arthritis? And we even sort of went through with them when we were looking at the questions, should we say medical cannabis? And they just said, let's just say cannabis, because people who are using it might be accessing it through the recreational market, but using it for medical purposes, as we know some patients do and many patients do, because they don't really know the other route, or the other route is too onerous. This is information. We provide a page from our website, just a snapshot, and this is, people have questions, you do a search, medical cannabis, this comes up. So what is medical cannabis? You have CBD and THC, lots of really great info in each section. And then there is a little video. It's a little long, but I might just give you just a little bit of it, and then I'll move on. So this should I press the green?
I want to try medical cannabis for arthritis. What do I do? Educate yourself. Visit the Arthritis Society's medical cannabis resources for helpful information. Talk to your doctor. They can help you understand the potential risks and benefits, and whether medical cannabis might be right for you. If your doctor thinks cannabis can help, they'll give you a medical document saying how much you should use and for how long. What if my doctor won't give me a medical document? There are many reasons why medical cannabis might be unsafe for some people. Or your doctor might think you should try other approaches first. If your doctor isn't comfortable with medical cannabis in general, ask for a referral to someone with more expertise in this area or to a medical cannabis clinic. Do I need a referral to a clinic? Speak to your doctor first, but if they can't help, you can contact most medical cannabis clinics directly. Call 211 for help finding clinics in your area. A doctor at a medical cannabis clinic should assess your situation and ask about your physical and mental health history, other physical or mental health conditions, your reasons for considering medical cannabis, and any medications you are taking. If they think cannabis can safely help your arthritis symptoms, they'll provide you with a medical document. I have a medical document. Now what? With a medical document, you can now purchase medical cannabis products from a licensed seller, register with Health Canada to produce your own, or designate someone else to produce it for you. It's recommended to buy medical cannabis from a licensed seller to ensure consistent dosage and quality. This video discusses how to purchase cannabis from a licensed seller. To learn more about producing your own or designating another producer, visit the Health Canada website. Register with a licensed seller. Once you have a medical document, you'll need to register with a company that is licensed to sell medical cannabis. Your doctor should be able to recommend a company, but you can also ask your pharmacist or medical cannabis clinic for a recommendation. Your medical document needs to be sent directly to the licensed seller, and you'll need to fill out a registration form. If you want to switch licensed sellers in the future, you can ask to have your medical document transferred, or you may require a new medical document. Place your order. Your doctor can explain what products to buy and how to consume them. A licensed seller can also help you understand the different products available. You can place your order online or by telephone using a credit or debit card. You can't pay using cash. Your order will be mailed to the address listed on your medical document. Can I buy cannabis for my arthritis from a retail store? The cannabis stores you see on the streets aren't licensed to sell medical cannabis. It's better to get a medical document and register with a licensed seller, because with a medical document, your doctor can monitor your symptoms and adjust your treatment if needed. Also,
There's
you
just
can
a
claim
taste.
cannabis
Maybe
as a
that was my
medical
alarm.
expense on your taxes.
Not my alarm, but someone has to be timed. So that's some of the information for patients. You can find that on our website, that video. And then these are Arthritis Talks webinars. We do these, we started doing these especially during the pandemic, more of them during the pandemic. We have like over 5,000 people at some of these webinars that attend. Medical cannabis seems to be the very popular webinars that people attend, and these are the subjects in all those webinars. And that's it, so thank you.
Thank you so much, Joanne. We have a minute for questions before we go on to Daphne. Any questions? Oh, okay.
Hi Daphne, thanks so much, that was amazing. I'm curious, with so many potential patients in your network, how are you preparing people to be a part of the current review, or are you?
We are, and we've actually already sent out to our volunteers, and our next step is to create some key messages and notes that will go out via newsletter to our constituents at Arthritis Society so that they can participate in it.
Great, thank you. So